Dr. Asad Salim's lecture on YouTube. Before beginning, subscribe my channel. Let's dive in. Rheumatoid diseases are a group of conditions where the immune system mistakenly attacks the body's own tissues. This friendly fire causes inflammation, pain, and sometimes serious damage to joints, connective tissues, and organs. These diseases are chronic and can range from mild discomfort to severe disability, impacting daily life. Inflammation is the main culprit, leading to swelling, stiffness, and persistent pain. While rheumatoid arthritis is the most recognized, there are over 100 related diseases affecting people of all ages. Diagnosis can be complex, requiring careful listening and investigation. Millions worldwide live with these conditions, affecting their work, relationships, and quality of life. For future doctors, understanding these diseases is about more than memorizing facts. It's about empathy and partnership in long-term care. Let's break down the main types, causes, and how we can help those affected.
Rheumatoid diseases come in several key forms. Rheumatoid arthritis targets joint linings, causing swelling, pain, and sometimes deformity, often in a symmetrical pattern. Lupus is a chameleon affecting almost any organ, with symptoms ranging from rashes to kidney problems. Spondyloarthritis, like ankylosing spondylitis, mainly affects the spine and pelvis, leading to chronic back pain and stiffness. Over time, it can cause the spine to fuse, resulting in a rigid posture. Sjögren's syndrome attacks moisture-producing glands, causing dry eyes and mouth, and can also lead to fatigue and joint pain. Each disease has unique features, but all involve the immune system turning against the body. They can overlap, making diagnosis and management challenging. Recognizing these patterns is crucial for effective treatment. Now let's explore why these diseases develop.
The causes of rheumatoid diseases are complex, a mix of genetics, environment, hormones, and lifestyle. Genetics play a role. Having a family member with a disease like rheumatoid arthritis increases your risk. Environmental triggers, such as infections, can set off the immune system in susceptible people. Hormones matter too. These diseases are more common in women, possibly due to estrogen's effects on immunity. Smoking is a major risk factor, especially for rheumatoid arthritis, and can worsen outcomes. Obesity and other lifestyle factors may also contribute by increasing inflammation. It's not one single cause, but a combination of factors that leads to disease. Understanding these helps us identify risks and guide prevention.
Symptoms vary, but joint pain, stiffness, especially in the morning, and swelling are classic signs. Chronic inflammation can lead to reduced motion and joint deformities. These are systemic diseases. Fatigue, low-grade fever, and weight loss are common. Specific signs help with diagnosis: rheumatoid nodules, lupus's butterfly rash, or Sjögren's dry eyes and mouth. Organs can be affected, causing symptoms like shortness of breath or chest pain. Symptoms often flare and remit. Patients may feel fine at times, but the disease can still cause silent damage. Continuous monitoring and treatment are essential, even during remission. The goal is to control inflammation and maintain quality of life. Next, let's see how these diseases are identified.
Diagnosing these diseases is like solving a puzzle. No single test gives the answer. It starts with a detailed history and physical exam, looking for joint swelling, rashes, or organ involvement. Blood tests check for inflammation, ESR, CRP, and autoantibodies like rheumatoid factor or ANA. Imaging, X-rays, MRI, or ultrasound can reveal joint or tissue damage, sometimes before symptoms appear. Diagnosis relies on combining clinical signs, lab results, and imaging findings. Doctors use established criteria to ensure accuracy and consistency. Early diagnosis is key to preventing long-term damage. It's a team effort between patient and provider. Once diagnosed, the focus shifts to management.
Treatment aims to reduce inflammation, relieve symptoms, and prevent damage. Medications include NSAIDs, corticosteroids, and disease-modifying drugs like methotrexate or biologics. Biologics target specific immune pathways and can be life-changing for some patients. Physical and occupational therapy help maintain mobility and function. Regular, gentle exercise is important. Think swimming or walking.
Patients should balance rest and activity and protect their joints. An anti-inflammatory diet, rich in fish, greens, nuts, and berries, can help. Education and self-management are crucial for long-term success. Managing rheumatoid diseases is a partnership. Empowering patients leads to better outcomes.